Thank you all for coming in today. I want to start, I don't normally talk about the national scene and the national level, but I got to say something about something that the administration, a couple of things the administration has just done. And I want people to think about how these things fit together. We know that the president's been pushing everybody to go back to school, despite the fact that we know the kids are as active spreaders and capable of spreading as adults, despite the fact that we know that their infection rates are going up and the data shows it. He's insisting they all go back to school. Then on top of that, yesterday we find out from FEMA that as of September 15th, FEMA will no longer reimburse school systems for masks for children, which means that these masks on mass scales are not cheap. They do not last perpetually, so they continually have to be replaced. So basically, they're going to undermine the ability of kids to protect themselves in school, which means that since these kids come from diverse neighborhoods all over the place, Montgomery County is a great example of that. You are likely to get cases brought into school. You are likely to encourage the spread of disease in school if the kids aren't wearing masks. And then to top it all off, he wants to cut down on non-symptomatic testing, which means that you couldn't even test these kids to see if they were carrying, if they weren't symptomatic, which means they will be able to spread, and the people who they spread to will not get tested until somebody gets a fever, a sneezing, and is deemed to be worthy of getting tested. This goes beyond neglect. It goes beyond regular carelessness. This is actually a set of actions which is going to endanger the communities in this country, and not just Montgomery County. I assure you, we're going to continue to try to make sure we can get masks to the people who need masks. When the schools are ready to open, we're going to make sure that the supplies are there. Hopefully there'll be saner people in charge when we get to that point. But we're going to make sure we can do these things. But people ought to put 1 + 1 + 1 together. It's almost like they're trying to drive this notion of herd immunity, that if I can get everybody sick, then the herd gets immunity, and if some people die, oh well. I don't have an oh well approach to whether or not some people die. I look at any death as an unfortunate and probably something, at least a large number, which could have been prevented. So I'm very disappointed with what's happening at the national level. I also want to say more locally, I'm a bit disappointed in the approach that Maryland is taking and going directly to phase 3. I guess I'm disappointed because none of the elected officials in the state got consulted on this. Nobody asked us, what do we know? What do we think? What are you hearing? What are you experiencing? And neither were the health officials. And so we're going into an area that is not being guided, from my perspective and from other people's perspective, by medical approaches, but more guided by a desire to reopen businesses. I get the desire to reopen businesses. I would love to have the tax revenue, but I don't want the tax revenue if the price to be paid is more sick people and more fatalities in our community. It is not worth it if you can't do it safely. So we are going to spend the next couple of days seeing what we can do differently. And what are the governor's guidance? Is there room for us to make steps forward? And where are the places that we're not going to go? So I won't say we're going to move into phase 3. We will continue to likely modify our phase 2, which we've been doing all along. I will, take full ownership. I wrote the governor a letter a couple of weeks ago after questioning the initial decision when the governor said you could have unlimited gatherings, but you couldn't have a musician or a comedian in front of these people. And I asked them, when he first did this, what sense did it make to allow 250 people to gather together and then say if a band shows up, you all have to go home? That didn't make sense. Or somebody gets up and starts telling jokes, well, you can't have an audience for it. So we asked whether, in our case, where we limit gatherings to 50 people, could we allow a performer or performers, if they stay on the stage, if we don't allow crowds to gather in front of the stage, if we don't allow dancing, if we don't allow standing and congregating between tables, basically we continue to allow people to act as if they were in a dining establishment and follow our rules of distancing and mask wearing and allow people to perform and entertain. That's a request we got from a number of venues that had been doing it and wanted to continue doing it. And we finally got guidance last week from the state saying that we could do it, provided it was primarily done as a dining establishment. And so we will definitely modify our rules on the entertainment to accommodate something which we asked for. So it's not like we weren't asking for things to be changed. This is something we pretty clearly thought could be changed. And finally, the state agreed with us on that. But we have trepidation over some of the other stuff, and we're going to examine this very closely and continue to make what we think are the best decisions for the health of our residents. As always, I rely on Dr. Gales and Dr. Stoddard and the professionals that they talk to for guidance on what kind of decisions that we're going to make in the county. And I think that's what all of us need to do. Despite the impatience and frustration with where we are where we are. I know I'm one of those people who a few weeks ago, when our cases were down around 50 a day, and we thought that was a big check downward from 200 a day. And we felt like, well, this is a good sign, this will keep going. The truth is, it didn't keep going. And after things opened up more in the state, our cases have been closer to 70 a day. We've had a couple of days around 90 to 100. So we are not in a place that I can say, you know, we made progress and we continue to make great progress and let's open the doors. It is not party time yet. It is not a time to relax. It is not a time to say, we've mission accomplished, as some famous person once said. None of those things are true. We're making progress, that is true, but we're not where we need to be. And when we're where we are need to be, we'll all have a great celebration of being able to reopen things in a more normal way. But until we're there, we're not there. What else do I want to talk about? So 97 positive cases on Tuesday. Yes, on Tuesday, 87 cases today. Remember, these are reported for the day before. Our testing volume in the state is down. The totals are below 15,000. We had much higher testing volumes. So if you're seeing lower cases at the state level, they're also testing fewer people at the state level. This is one of the other scenarios which worries people. I can make cases go away if I don't test people. That doesn't mean they're not there. It just means that we don't see them. So we're trying to ramp our testing back up. And hopefully what's happening at the statewide level is a glitch and something that eventually will get to higher levels of testing. Our program, like I said, is back up and running. We've done more than 1,700 county-issued COVID tests since Thursday. We have 2 clinics using CDC trailers. Today at Lake Forest Mall, there were 30 people waiting at 8:30 for the opening. Friday will be at the Wheaton Rec Department. Both these testing sites are drive-ups. On the average, the time for us to get specimen results back has been 62 hours. We're hoping that we can get this back and continue to push this below 62 hours. It would be good to be basically on 24 hours so we can very rapidly get ourselves on the trail of the contacts that people have had. You got to remember, every day we don't know whether somebody's positive is a day that we don't know whether that person's spreading. And so the sooner we get control over this, the better off we'll be. We all continue to feel that public schools and schools in general are really not safe to open. I was just told that JMU reported 500 cases and that they were closing and sending people home. It is very hard to control where everybody's been, whether it's the faculty, the staff, or the students and their families. And so the notion that it's just the school doesn't take into account the fact that the people going into that school may have vastly diverse experiences in the community. And we continue to think not a good idea to go there right now. We do understand the guidance that's coming from the state, and we're confident that the school board will continue to make the best decision that they need to make, taking into account the safety of their staff, their students, and and the community at large.